The pandemic and the efforts to ramp up the vaccine rollout. More than 41 million doses have been distributed, nearly 22 million have been administered, and we're starting to see some encouraging signs. Cases are declining in some parts of the country, and hospitalizations are the lowest they've been in more than a month, but there are growing concerns over those new variants of the virus. Eva Pilgrim has the latest.
This morning, as concerns intensify surrounding those COVID variants predominantly from overseas, ABC News has learned the U.S. will begin restricting travel from South Africa, banning most non-U.S. citizens who have recently traveled to the country from entering the states, as well as reimposing the travel ban for Brazil, the U.K., Ireland, and 26 countries across Europe in an effort to mitigate the spread of the virus. The move comes as the U.K. variant, which scientists say is likely more contagious than the initial version and possibly may be more dangerous, has already been reported in at least 22 states.
Even if the virus ended up not being any more deadly, the fact that it is more contagious means it's going to end up infecting a lot more people. It's going to cause more hospitalizations and a lot more deaths. So the fact that it is more contagious is a real source of concern, I think, for all of us.
This weekend, the U.S. crossing yet another milestone. More than 25 million COVID-19 cases reported here since the start of the pandemic. According to the COVID Tracking Project, last week an average of 2 Americans tested positive every second, with 1 death reported every 30 seconds. The push to get vaccines distributed urgent but slow. Finally passing the milestone 20 million shots administered announced this weekend, a number the previous administration had anticipated to reach in December. But some states now temporarily canceling appointments, saying they don't have supply in stock. Millions of doses are being delivered throughout the country every week. But in New York City, Citi Field, the home of the Mets, was supposed to open as a mass vaccination site this week. City officials telling ABC News that plan has been delayed due to the shortage of vaccine on the federal level. The new CDC director frustrated by the pass down she was given by the previous administration.
I can't tell you how much vaccine we have, and if I can't tell it to you, then I can't tell it to the governors, and I can't tell it to the state health officials. If they don't know how much vaccine they're getting, not just this week, but next week and the week after, they can't plan.
And more vaccine could be on the way to help supply mass vaccination sites like this one. Johnson & Johnson is expecting their final phase 3 results sometime in the next 2 weeks. That means that they could be before the FDA for emergency use authorization by mid-February. That vaccine is a single-dose vaccine. Diane?
All right, Eva Pilgrim at the vaccination site in Jones Beach, New York. Eva, thank you. And earlier today, Dr. Anthony Fauci spoke to Good Morning America about the new coronavirus variant in South Africa and the difference between working for the Trump administration and the Biden administration. Take a listen.
So we've seen this announcement of the travel ban from South Africa, reimposing travel bans to other areas. But at this point, are they really going to do any good?
You know, I believe so, George. I think that was a prudent decision because right now, even though our surveillance isn't as comprehensive as we'd like it to be yet, it does not appear that this particular mutant is in the United States, although it well may be. But if you have a free inflow of people from a country in which that mutant is clearly dominant, I talk to my colleagues often in South Africa, it clearly is dominant there. I believe the travel ban will be important in addition to having a situation where anybody coming into the country now is going to be required to have a negative test before they even get on the plane, when they land, to have a degree of quarantine as well as another test. So I believe it was prudent, even though it's never perfect. There's always a possibility and even a likelihood of some slippage. But I think the ban, which was discussed very intensively by the group, was the right decision.
You've been under a lot of pressure over the last year. What's the number one change you've noticed from President Biden from President Trump?
It was very clear, George, and it was articulated multiple times. The president has said it publicly, but in a private session, just sitting down with him and with the medical team, he's very serious. He said science is going to rule. We're going to go by the facts. We're going to go by the evidence. We're going to go by the data. If something is wrong, like I just said, we're going to just try and fix it. And we're going to pull out all the stops to get our arms around this. Getting the vaccine situation on track is his highest priority. So, I mean, the idea that the president himself sits down with you and says, I want science to rule, go out there and do everything we need to do to get it done, just is really very refreshing.
You also faced serious personal threats over the last year. I was kind of horrified to read you had one incident where you opened up an envelope and feared you were poisoned.
Yeah, that was very traumatic, George, but more so for my wife and children, who just were really, really horrified by that. Because, you know, for a while there, as I said in the Times article, you know, there were only three possibilities. Either it was a hoax, which I was hoping and praying it was anthrax, which would require my taking, 30 to 60 days of Cipro, or it was ricin, which means I was dead, no matter what you could do. So for a point there, until the FBI and the hazmat people figured out what it was a very, very difficult period.
Well, we are glad you were okay. Dr. Fauci, thanks for your time this morning.
Good to be with you, George.
And for more, let's bring in ABC News medical contributor and South Shore Health infectious disease specialist, Dr. Todd Ellerin. Dr. Ellerin, good morning. We just heard there from Dr. Fauci discussing President Biden's plan to reinstate a travel ban. This new variant from South Africa, the new variant from the UK, the other one in Brazil, how dangerous are these? What should we know about them right now?
Good morning, Diane. I think this travel ban does make sense because the variant, especially the South African variant, appears to be more contagious and also appears to be resistant to some of the monoclonal antibodies. And in fact, in the lab, we've seen that some patients who've been previously infected have actually had a decreased immune response when tested in the lab. So this is a concerning variant. Anything that's more contagious will lead to more hospitalizations and deaths. So I do think the travel ban being reinstated makes sense.
And we're hearing the Johnson & Johnson vaccine could soon be approved in the U.S. How long do you think until that happens, and how significant will that be?
Well, I think this is very significant. And the reason is because this is a single-dose vaccine. And with a single-dose vaccine, if it's effective, you can imagine that's going to really change the landscape of logistics and make it much easier to give more vaccines. So we're very hopeful. One thing I did want to say, though, about previous vaccination against the variants is a press release today by Moderna basically showed that their vaccine elicits neutralizing antibodies in a robust way against the UK and the South African variant. So that is very, very promising and makes one think that these are going to work in the real life situation.
There's also a new report that breast milk could help young children fight off the virus. How legit is that?
Okay, so breast milk in general is one of the best strategies to boost the immune system of infants. That's always been shown. It's been shown that breast milk reduces lower respiratory tract infections. So it makes sense that moms who have recovered from COVID-19 by breastfeeding their babies, that they're going to give the babies those type of antibodies that are really going to improve the baby's defense against COVID-19. And if the baby gets COVID-19, perhaps they'll have much less severe disease. So I'm thumbs up on that strategy.
All
breastfeeding.
Right. I like it. We also heard from a viewer today who was asking about the need to keep masks on after being vaccinated. So I was hoping you could just reiterate that and explain why.
Okay, so Diane, it's a really important question. I think ultimately, if you're in a group where everyone is vaccinated, fully vaccinated, then it's reasonable to take the masks off, knowing that, the vaccine's not 100%. So if you have someone who's very compromised among your group, maybe that person will leave the masks on, or maybe you will choose to leave the masks on. But importantly, what hasn't been proven is if the vaccines can reduce transmission. So I've been vaccinated already, but the reason that I'm wearing my mask is it's still possible that I could be infected. I may not develop any disease, but I can have virus replicating in the back of my nose and potentially transmit to others. So that's why if you're in a group where there's uneven vaccination, you want to keep those masks on and keep the distancing.
All right. Dr. Todd Ellerin, always great to have you. Thank you.
Take care, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.